So you've decided to move to Jamaica and you're concerned about your children's education or yours and their health care. Well, let's jump into it and see what the options are for you.
Jam Fam family, the Jam Fam family, yeah. Jam Fam, come hang with me.
Hello, Wagwan. Pick up yourself, whether you're there yard or you're there abroad. Welcome back to another episode of Life with the Jam Fams. On this episode, we're going to be looking at moving to Jamaica. What about education and healthcare? Moving to Jamaica, what about education and healthcare? Now, these two things are tricky things to talk about depending on the audience with which you're talking. So I'm going to make sure I go through it with as much detail as I can for you. So I'm going to split it up into the two different things. So I'm going to talk about the education and then I'll talk to you about the healthcare. So in terms of education, again, it depends on which part of the country you're going to go to. However, education in Jamaica, there are a range of schools. In the primary sector, you have primary schools as well as still some all-age schools. Then when you go to the secondary level, you have junior high, you have high school, you have comprehensive high school, you have technical high school, and you have different vocational pathways and what people refer to as traditional high school, which is the academic pathways. Now, there are good performing schools right across the country, and therefore it depends on where you're going to be that is going to make the difference. The other thing to take into consideration is the type of school that you want your child to go to. So you could have the option of public school or private school or independent school, whichever you refer to it as. So the public school is schools that are within the government portfolio. Private schools are schools that different private entities run and operate. Now, in the private school, you are going to need to pay a range of different expenses. In the public school, there are still some things that you pay. However, in Jamaica, it is education is free to children all the way up to the age of 18 if they're still in secondary and sixth form. So education is free. However, when they go to school, there are still some things that they need to afford and pay for. So they need to pay what's called an auxiliary fee. And this encompasses a range of different things. It goes to help towards assisting with the support within the education sector. So the staff who are there that are providing additional support. It also caters for things like their school book rental and some of the other facilities that they're going to be needing whilst they're at school. So the free education covers them being taught by a teacher, that provision. The auxiliary fee helps with funding out the additional expenses that schools have to afford in order to provide the best quality of education to the child that is at school. In the private sector, there is a school fee to be paid and then the other additional fees that were just mentioned. So this could mean that you pay for their lunch. If when they're at school, you pay for their travel, for how they will get to school. And of course, you need to buy the resources that they go to school with. This happens right across the sector. So you have to buy their books and other equipment that they're going to need. You will also need to buy things for certain practical subjects and for their projects and assignments right across the education spectrum. So that's what you have and what they will be experiencing when they do come and the costs that are there for you in terms of the education. But again, the education in general is free in Jamaica, so they don't need to pay a school fee when they're going to public school. They pay a school fee to go to private or independent school. And then what you will pay is an auxiliary fee, and this is paid in both different types of establishment, whether they're public or private, because it covers additional costs for the effective running of the schools.
Had adequate numbers of teachers in the classrooms.
With that bounce back, the ministry pressed on with the concept of reforming education through the construction of STEM schools, announcing the first set to be located in St. Anne.
We have always traditionally taught science, technology, engineering, and mathematics, but as discrete subjects, right? One by one, we want to integrate and create that environment where our children can see the magic of bringing together science, technology, engineering, mathematics, the arts, because maths is in a lot of things we do. So we have to ensure that we focus on STEM as a meaningful part of the education process.
At the same time, there was increased student registration in the Sixth Form Pathways program.
Listen, that is my favorite topic to talk about. They have embraced the Sixth Form Pathways program. Well over 24,000 students are engaged in the three different segments. What their parents are seeing is that their students are gainfully engaged, and the Sixth Form Pathways program offers in turn.
Now, moving over to the other aspect, which is healthcare. There are many people who are concerned about the health provision that Jamaica has to offer when they contemplate whether or not they're going to move to Jamaica. Now, Jamaica offers free healthcare. So there are two pathways in Jamaica for the healthcare. There is public healthcare and there is private healthcare, which is similar to what is available in many other countries. Now, Jamaica's public healthcare provide universal care for its citizens and residents, and this is reasonable access to free health care. Now, if you go to any of the public hospitals and clinics and see the practitioners there, then you have access to free health care. Also, any prescriptions that are issued at the clinics or the hospital are also generally filled free of cost. Now, people who have specific health conditions, they are also catered for under the National Health Fund. Most of these people are card carriers, and therefore when they go to these different facilities, they get their prescriptions filled and they with no cost to them.
The National Health Fund was established in 2003 to provide support to the public health system in Jamaica. This is done mainly through our NHF and JADEP cards that provide subsidies to the people of Jamaica. Residents of Jamaica get subsidies on drugs for 17 chronic illnesses. Last year, the fund expended $4 billion in providing subsidies to persons living in Jamaica. The fund is also involved in the procurement, warehousing and distribution of pharmaceuticals for the public health system. Contracts are currently held with 80 pharmaceutical suppliers from 20 different countries. The fund spends annually about $4 billion in procuring these drugs. The National Health Fund manages 104 drug-served locations, dispensing drugs to over 600,000 Jamaicans in the public health system annually.
Also, some surgeries are also at no cost to the patient, depending on whether or not they fall into some of the chronic conditions that are catered for within the fund, the National Health Fund for the country. And so if they fall into those categories and they have to do surgeries that are related to those medical conditions, then those are normally at no cost to the patient. Okay, so and these include things like circulation, blood pressure, diabetes, among others. So there are a list of those chronic conditions that are on the National Health Fund website that you can have a look at. Also, there is another program that is in place for the elderly, and that one is called the Jamaica Drug for the Elderly program, which is JADEP. It is a collaboration between private and public sector to ensure that the elderly are able to get their medication at a reduced cost. And to some extent, if those people who are on the JADEP program are also National Health Fund card carrier, then of course their medication will be free of cost.
Senior citizens in the cohort 60 years and older represent the fastest growing demographic segment of the society, as more people are living longer. This changing dynamic has prompted the government to ensure improvements in the level of responsiveness to new expectations and needs of our seniors. The need for quality healthcare is top of the list. An aspect of quality healthcare service is the prompt access to affordable medication. So the Ministry of Health and Wellness, through the National Health Fund NHF, has been leading the government's charge in providing critical supplies of medication at subsidized costs to persons in need. That includes seniors. The NHF has been improving its service by employing ingenious means of delivering medication and reducing waiting times and overcrowding at prescription outlets.
We are using a number of services in order to make it easier for our customers. We have the Prescript mobile app. We have a drop-off and pick-up service. We have scheduled refill for persons who come to the pharmacy frequently with the same medication. And we have a number of other initiatives in which we contact clients to work out easy ways for them to receive their medication.
There are also some other programs, some other healthcare that can be free based on whether or not you fit into any of those categories that are funded at no cost to the patient. Going to the public healthcare system is a walk-in or drop-in service rather than run as appointments necessarily. And so that could cause some wait when you go there. In a similar way as you would wait when you go to a walk-in center or the emergency room in places like the UK or Canada, who operates a similar reasonable access to public healthcare to their citizens. In the UK and Canada, you might have a slightly different approach because they have appointments for specific referrals that you would need. And so your waiting is done slightly differently because you would be referred and be added to a waiting list for when the appointments becomes available for you to then go and see the specialists that you need to see. Here, the appointments are you turn up and you wait to be seen, and then you get told where to go and what next will be done. However, in both scenarios, those would be free of cost to the patient. If you choose to go down the route of private healthcare, then of course you will need to pay. And even that option, if you are have access to the National Health Fund, then you will also find that your prescriptions that are given from the private sector will have a reduction in cost when you go to fill those at the pharmacies. So that's it pretty much in a nutshell. When you think about the education and the healthcare, you've got two pathways that you can take. You can go down the public or you can go down the private. Either way you decide to go is totally going to be up to you when you decide that you're going to be coming here and staying. So give it some thought and then decide how you think that it works best for you and for your family. There are many different health facilities that are in the country. Jamaica is one of those countries who are in the run as tourism, health tourism, and therefore the facilities are here to provide those things that people are will need. You know, there are lots of different things that are happening in terms of developing and building out the healthcare in Jamaica. So, and equally building out the education provision that Jamaica and Jamaican children will be exposed to. Eliona is on day 2 of making dinner. So, just want to see what it is that I'm going to be getting because here she busy in here. So, Mrs. we are make so Missy lettuce, Missy cheese. Missy mayo, Missy ketchup. Is that burger bun or hot dog? What am I going to see? Missy something like frankfurters. Oh. So what's this?
Hot dog.
Is that it? Oh, that's my dinner? Okay. Let me see if you're healthy. So what you do, you put so I have
I crushed
cheese.
the inside to make it nice and crunchy and warm.
Oh, well, how did you do that? In the toaster or in the pot? You put it in a pan, okay. And so I can see lettuce,
Sausage, ketchup,
frankfurter.
mayonnaise,
Okay.
and cheese.
So that's for dinner today. Okay then. Well, are you going to make it day three in a row too?
You'll find out tomorrow.
Okay, so I'm looking forward to what I'm going to get tomorrow.
If you're going to get tomorrow.
Oh gosh, so what that mean? Me have to come make it for myself?
If you're going to get tomorrow.
What, I'm back on mommy cooking duties tomorrow?
I'm saying if you get tomorrow, then you'll see what you get.
Okay, so yesterday I got chicken burger with fries. So I'll see what I get the next day. You know what I'm feeling for and could do well with?
Fish and bun?
I do want to have some fish and bami, but I could do well with you making me, guess what?
Something with sardine?
No.
Oh.
Pizza!
The same pizza I made in the air fryer? Like the bigger version?
Well, you could make it in the oven if you want to. But, just saying, that would be awesome.
I have no yeast.
No pressure. It's just a suggestion.
But I didn't have the yeast.
So make it like you make it the last time. Because the last time you did it yeastless. So use the same raising agent we did use last time. Because that tastes good when you do it. The mini ones that you did. Yeah. Well, it's just an idea. Just saying.
You'll find out what you get tomorrow.
Okay. I'm looking forward to it. So this is mine? Mm-hmm. Okay. Thank you.
I need to see your taste test.
I like the crunch. Tastes good. Now, I just hope you feel my tummy.
Well, you got two, so hopefully.
See? Thanks. There are quite a few fruit trees around, and I'm trying to get a few more. So this one is lychee. My father came by and planted this one here. He planted a few other trees, so I'm just going to show you what those are. This is a type of guava, and from what he said, the fruits on it should be big. I'm hoping to eat fruit off of it soon. This one is rosemary that he's planted here, and I will show you another rosemary that he planted. And this one is a much bigger rosemary that's planted here, so we'll have that to use soon. And this one is a mango tree. He didn't plant this one, it's been here, but we're trying to care for it because when I came, one of the limbs was broken off and the leaves were eaten off, so it's springing back up at the moment since we've been caring for it. So I'm hoping to see what variety of mango it is. This is a small coconut tree. We have a few more, but this one is one of the smallest. And again, we're trying to care it because you can see from the leaves that it has been attacked and eaten. And I think it's probably by goats when they're passing by, because one of our neighbors owns some. So make a decision based on the information provided here, and you can go and research elsewhere. This is just explaining to you how it works here, because I'm also learning and finding these information out as I'm going as well. Bye for now, and we'll see you in the next one.